Assalamu alaikum. From bacterial protein synthesis inhibitors, our next class of drugs is tetracyclines, which include minocycline, doxycycline, demiclocycline, and tigacycline. Only two classes from bacterial protein synthesis, tetracyclines and aminoglycosides. They act on 30S subunit, while all other bacterial protein synthesis inhibitors have targets on 50S ribosomal subunit. So the mechanism of action of tetracyclines is that they bind to 30S subunit and prevent binding of incoming charged transfer RNA unit. We have already discussed all these steps in our previous video of bacterial protein synthesis inhibitors. Do you remember which step is this? About the resistance to most tetracyclines is widespread. Mechanism of resistance include the development of mechanisms like efflux pump mechanism, which is for active extrusion of drug, and the second mechanism is the formation of ribosomal protection protein that interferes with the binding of tetracyclines. About the spectrum, tetracycline is broad spectrum. Tetracyclines are bacteriostatic drugs. The spectrum includes gram positive, gram negative, rickettsia, chlamydia, mycoplasma, and some protozoa. Let's see the clinical uses of tetracyclines. First one, we have doxycycline, which is very useful in prostatitis because it reaches high levels in prostatic gland. Doxycycline is also used in the treatment of Lyme disease as well as in the treatment of amoebiasis. Doxycyclines are also used for the prevention of malaria. In our previous video, we have discussed that macrolides are used for the treatment of community acquired pneumonia. Here, the doxycycline is an alternative to macrolides in the initial treatment of community acquired pneumonia. Next one is minocycline. Minocycline is the only tetracycline that reaches high concentration in saliva and tears. And minocycline is useful in meningococcal carrier state. Then we have tigacycline, which is a glycide derivative of minocycline. This tigacycline is used in complicated skin, soft tissue, and intestinal infections that are caused by the resistant gram positive like MRSA and vancomycin resistant Enterococcus faecium. Gram positive, gram negative, and anaerobes. Let me repeat this point again. Tigacycline is used in complicated skin, soft tissue, intestinal infections that are caused by resistant gram positive like we have MRSA, VREF, gram negative, and anaerobes. Next one is demiclocycline. This demiclocycline inhibits the renal actions of antidiuretic hormone. So it is used in such patients that have ADH secreting tumors. So demiclocycline is used in the management of patients with ADH secreting tumors. Let's see other clinical uses of tetracyclines. Tetracyclines are recommended in the treatment of infections that are caused by chlamydia, rickettsia, vibrios, mycoplasma pneumoniae. and some spirochetes. Tetracyclines are also backup drugs in syphilis. Do you remember what is the drug of choice for syphilis? It is penicillin G, natural penicillins. Tetracyclines are also used in respiratory infections. Against infections in chronic bronchitis, tetracyclines are used prophylactically. They are also used in the treatment of acne and leptospirosis. Let's see the pharmacokinetics. The oral absorption of tetracycline is variable. Absorption of tetracyclines may be impaired by food because tetracyclines bind with multivalent cations like calcium, magnesium, and these multivalent cations can decrease the absorption of tetracyclines. Tigecycline is formulated only for IV use. All the tetracyclines undergo enterohepatic cycling. About the excretion, most of the drugs are eliminated in the urine. There are two exceptions: doxycycline that are eliminated by feces, and tigecyclines are eliminated by bile. As the most of drugs are eliminated in the urine, so excretion is by kidney for most, while for doxycycline, liver. Tetracyclines have wide tissue distribution, so they can tetracycline crosses placental barrier and they are contraindicated in pregnancy. About the half life, doxy and minocycline both have longer half lives as compared to other tetracyclines. Half life of tigecycline is almost 30 to 36 hours. About the toxicity of tetracyclines, fetal exposure to tetracycline leads to tooth enamel dysplasia and irregularities in bone. In younger children, treatment with tetracycline can cause tooth enamel dysplasia and crown deformity when permanent teeth appear. They also cause photosensitivity, specifically by demiclocycline and doxycyclines. Tetracyclines also cause vestibular toxicities, especially doxycycline and minocycline. Tetracyclines also cause hepatic toxicity. High doses of tetracycline, especially in pregnant ladies and those that have already hepatic diseases. High doses of tetracycline can impair liver functions and can lead to hepatic necrosis. They also cause renal toxicity, like we have Fanconi syndrome. Tetracyclines also cause GIT disturbances that ranges from mild nausea and diarrhea to severe, possible life-threatening enterocolitis. Because they causes disturbances in the normal flora, this can lead to candidiasis and colitis. Our next drug is aminoglycoside. Let's repeat the line with me. Only two classes of bacterial protein synthesis acts at 30s subunit. These are aminoglycosides and tetracycline, while all other classes of bacterial protein synthesis acts at 50s subunit. So the mechanism of action of aminoglycosides is that it binds at 30s subunit and interferes with protein synthesis in three ways. First one is it inhibits translocation. Second is it blocks formation of initiation complex, and the third one is it can cause misreading of code on the messenger RNA template. All the bacterial protein synthesis inhibitors we have studied till now are bacteriostatic, but aminoglycosides are bactericidal. What the O in the aminoglycoside is saying? It is saying that aminoglycosides are oxygen dependent. So it means all the anaerobes are resistant to aminoglycosides. Let's see the spectrum. The gentamicin, tobramycin and amikacin are important drugs for the treatment of serious infections that are caused by aerobic gram-negative bacteria including E. coli, Klebsiella, PPP, which is Proteus providentia and Pseudomonas, and Serratia species. These aminoglycosides also have activity against strains of gram-negative rods like Haemophilus influenza, Moraxella catarrhalis, and Shigella. Streptomycin is used against TB, and streptomycin is a drug of choice for tularemia and bubonic plague. Aminoglycosides are often used in combination with penicillins and cephalosporins. Let's see the synergistic action of aminoglycosides. Aminoglycosides with penicillin G or ampicillin is used to treat the infections caused by enterococci, and aminoglycosides with penicillin or third generation cephalosporins are used to treat infections that are caused by P. aeruginosa. Let's see the pharmacokinetics. Aminoglycosides are polar compounds, so they are not absorbed orally. They are administered intramuscularly or intravenously for systemic effects. Excretion of aminoglycosides is directly proportional to creatine clearance. It means glomerular filtration is the major mode of excretion for aminoglycosides. With normal renal function, the elimination half-life of aminoglycosides is 2 to 3 hours. Let's see the toxicity of aminoglycosides. They cause nephrotoxicity. There are 6 to 7% incidences that includes proteinuria, hypokalemia, acidosis, and acute tubular necrosis. These effects are usually reversible, but if aminoglycosides are used along with such drugs that are nephrotoxic, like we have vancomycin, amphotericin B, cisplatin, and cyclosporin, they can enhance the nephrotoxicity. About the ototoxicity, incidences are 2%. This ototoxicity can be reversible or irreversible. If hair cells are being damaged, then because of hair cell damage, deafness can occur, which is irreversible. And if there is vestibular dysfunction, then this ototoxicity is reversible. The toxicity may be enhanced by loop diuretics. Next we have neuromuscular blockade. Aminoglycosides can block the release of acetylcholine. As they are blocking the release of acetylcholine, so they can enhance the effects of skeletal muscle relaxants. So be aware to use aminoglycosides in a patient of myasthenia gravis, because myasthenia gravis patient has already weak muscles and aminoglycosides can exacerbate the condition.